Hi everyone, I'm Sophia Vicari, founder of The Princess Promise, and I am here with
Dr. Rob Frankel with Mainline Gastroenterology Associates.
Well, welcome Dr. Frankel. Thanks for dropping by.
Of course.
So, inflammatory bowel disease is called inflammatory bowel disease, but what I want to know today is, can it affect areas other than the bowels, other than the intestinal tract?
It's a good question, and actually it can. So even though it is called, as you said, inflammatory bowel disease, it can cause inflammation in other parts of the body. And that's probably because the body, it's mainly targeting the intestines, but sometimes those immune complexes, go other places. So one of the most common places where people have an extraintestinal manifestation is the skin. So a lot of times with Crohn's or ulcerative colitis, there's a couple skin conditions. We won't go too much into them. As I was telling you beforehand, it's very tough to explain these things without pictures.
And I don't think you want to Google the pictures either.
You can, so for example, the more common skin conditions associated with Crohn's disease, something called erythema nodosum, which is a very painful inflammation of the fat, usually most commonly over like the shins on the lower legs. And in ulcerative colitis, there's something called pyoderma gangrenosum, which is just a sort of an ulcerated type of skin condition. Again, very tough to describe in non-medical terms without showing you pictures. So those are some of the skin conditions that are related to certain diseases, although Crohn's, ulcerative colitis do cross over a bit. So some of those conditions, pyoderma gangrenosum will happen in Crohn's, and erythema nodosum will happen in ulcerative colitis. There's also, not just disease-specific skin conditions, but things like psoriasis and eczema are more common in patients who have Crohn's and ulcerative colitis. Sometimes just because, but other times it's medication-related. So it's one of what we call a paradoxical reaction to medications like Remicade, Humira, Cimzia, Simponi, is that while those medications can actually be used to treat severe eczema and psoriasis, actually more psoriasis than eczema, it actually can cause them, that's why it's called paradoxical. So that's the skin component. There's certainly joint issues that are common in Crohn's and ulcerative colitis as well. You can have your large joints affected. Usually when large joints are affected, such as the knees, the hips, shoulders, usually it's just 1, 2, 3 joints that are involved. That's one form of arthritis. There's another form of arthritis where it affects lots of small joints, such as in the fingers and toes and ankle joints, those sorts of things. And then there's arthritis of the spine and of what's called the sacroiliac joints, which is sort of where the bottom of the spine meets the hip bones. So those are a couple other places where you can get arthritis. And then the third thing is your eyes. So you can actually have inflammation of your eyes. There's different levels of the eyes that could be inflamed. There's iritis or iriditis and uveitis. There's anterior uveitis, posterior. It's a whole lot of things in the eyes. If your eyes hurt or itch or look red, you can go see your doctor about that.
Definitely see your doctor.
So those are the main forms of extraintestinal manifestations. There's some other things too. We always have you check your liver numbers when we check your blood test, because there is a liver condition that can sometimes be associated with more ulcerative colitis than Crohn's disease, but can affect both. So even though it's just called inflammatory bowel disease, there are other things that can act up when whether or not you have active disease or not. Some of these are disease independent, where just because you have the disease, you can get these things, even when it's under good control. Sometimes some are disease dependent, so depending on whether your disease is active or not will make these things come out.
And what about mental health issues? Because they're technically not in the gastrointestinal tract, but I'm sure they probably are affected.
Yes, I completely forgot to mention that. So mental health is important, and mental health is important in any state of being, whether or not you have inflammatory bowel disease or not. We know that the GI tract and the brain have a very interesting relationship. We know that when your gut is angry, it talks to the brain. When the brain is angry, it talks to the gut. So frequently when people have anxiety or stress, it'll get your gut moving a little bit more. It will cause more pain, cause more symptoms. And the opposite of that is true as well. So when you have active inflammation, or whether that's with inflammatory bowel disease, or whether you just have a lot of symptoms, whether it's related more to irritable bowel syndrome, we know that when you're more active down below, you're more active up above. So people who have inflammatory bowel disease, people who have irritable bowel syndrome, are much more likely to have depression or anxiety than people who don't have those conditions. So while unfortunately with these things, you can't check a blood test, you can't do any imaging for these things. they do exist, and it's important to recognize them.
Absolutely, and recognition is a great way to help get through all of these conditions that may pop up. So don't be scared by this video. Yes, there are other things that can happen to you because you have inflammatory bowel disease. It doesn't mean that they will happen to you, and if they do, it's important to write down your symptoms, keep track of any lifestyle changes that happened when these things popped up, and bring it up to your doctor. And if your doctor is an understanding, awesome doctor like Dr. Frankel, Dr. Nandi, Dr. Ehrlich, then they will work with you to help you get to where you need to be.
Yeah, the majority of people won't get these things. I mean, I think the skin conditions happen to about 1/3 of people, and the other ones are a little bit less than that. So not everybody will get these things, but we have ways to manage them. And a lot of times we'll be able to fix those for you as well, or refer you to to a rheumatologist or a dermatologist or an ophthalmologist, eye doctor, someone who can help you get through your symptoms or treat your symptoms.
Mm-hmm.
And for mental health, obviously, we have good practitioners who are very skilled at treating patients who have not just depression, anxiety in general, but people who have irritable bowel and people who have inflammatory bowel disease who also have those conditions.
Absolutely. One thing that my general practitioner recommended to me was psychologytoday.com, and that's how I found my therapist. You can narrow it down by location, whether you want a male therapist or a female therapist, what kind of insurance they take. So I highly recommend that website if you are in the market for one. But, yeah. Thank you so much for stopping by. We really appreciate all the knowledge that you dropped on us today, and have a great day.
Bye, everybody.